Urinary tract infection: causes, symptoms, treatment, prevention. Urinary tract infections account for over 6 million patient visits to physicians per year in the country. UTI is a serious health problem that you need to know how to prevent or manage if you already have it. In this video, you will learn everything you need to know about urinary tract infection, including its causes, warning signs, symptoms, treatment, and prevention. At the end of the video, you will discover an alternative treatment to fight any type of UTI. Please like the video if you find it useful and subscribe to the channel to help us grow our community on YouTube. Urinary tract infection, commonly called UTI, is an infection that affects part of the urinary tract. About 150 million people develop a urinary tract infection in a given year. The infection is more common in women than men. In women, they are the most common form of bacterial infection. Up to 10% of women have a urinary tract infection in a given year, and half of women have at least one infection at some point in their lifetime. UTI occurs most frequently between the ages of 16 and 35 years. Recurrences are common. Types of urinary tract infection. There are different types of UTI. A urinary tract infection may involve only the lower urinary tract, in which case it is known as a bladder infection. Alternatively, it may involve the upper urinary tract, in which case it is known as pyelonephritis. If the urine contains significant bacteria but there are no symptoms, the condition is known as asymptomatic bacteriuria. If a urinary tract involves the upper tract and the person has diabetes mellitus, is pregnant or male, or immunocompromised, it is considered complicated. Otherwise, if a woman is healthy and premenopausal, it is considered uncomplicated. In children, when a urinary tract infection is associated with a fever, it is deemed to be an upper urinary tract infection. Each type has different characteristics. Symptoms from a lower urinary tract infection include pain with urination, frequent urination, and feeling the need to urinate despite having an empty bladder. Symptoms of a kidney infection include fever and flank pain, usually in addition to the symptoms of the lower UTI. Rarely, the urine may appear bloody. In the very old and very young, symptoms may be vague or nonspecific. Warning signs and symptoms of urinary tract infection. Lower urinary tract infection is also referred to as a bladder infection. The most common symptoms are burning with urination and having to urinate frequently, or an urge to urinate in the absence of vaginal discharge and significant pain. These symptoms may vary from mild to severe. In healthy women, last an average of 6 days. Some pain above the pubic bone or in the lower back may be present. People experiencing an upper urinary tract infection or pyelonephritis may experience flank pain, fever, or nausea and vomiting, in addition to the classic symptoms of a lower urinary tract infection. Rarely, the urine may appear bloody or contain visible pus in the urine. Children. In young children, the only symptom of a urinary tract infection, UTI, may be a fever. Because of the lack of more obvious symptoms, when females under the age of 2 or uncircumcised males less than a year exhibit a fever, a culture of the urine is recommended by many medical associations. Infants may feed poorly, vomit, sleep more, or show signs of jaundice. In older children, new onset urinary incontinence, loss of bladder control may occur. About 1 in 400 infants of 1 to 3 months of age with a UTI also have bacterial meningitis. Elderly. Urinary tract symptoms are frequently lacking in the elderly. The presentations may be vague, with incontinence, a change in mental status, or fatigue as the only symptoms, while some present to a healthcare provider with sepsis and infection of the blood as the first symptoms. Diagnosis can be complicated by the fact that many elderly people have pre-existing incontinence or dementia. Urinary tract infection causes. The most common cause of infection is Escherichia coli, though other bacteria or fungi may sometimes be the cause. Risk factors include female anatomy, sexual intercourse, diabetes, obesity, and family history. Although sexual intercourse is a risk factor, UTIs are not classified as sexually transmitted infections, STIs. Kidney infection, if it occurs, usually follows a bladder infection, but may also result from a blood-borne infection. Uropathogenic E. coli from the gut is cause of 80 to 85% of community-acquired urinary tract infections, with Staphylococcus cephalitis being the cause in 5 to 10%. Rarely they may be due to the viral or fungal infections. Urinary tract infections due to Staphylococcus aureus typically occur secondary to blood-borne infections. Chlamydia, Trichomonas, and Mycoplasma genitalium can infect the urethra but not the bladder. These infections are usually classified as urethritis rather than urinary tract infections. Intercourse. In young sexually active women, sexual activity is the cause of 75 to 90% of bladder infections, with the risk of infection related to the frequency of sex. The term honeymoon cystitis has been applied to the phenomenon of frequent UTIs during early marriage. In postmenopausal women, sexual activity does not affect the risk of developing a UTI. Spermicide use, independent of sexual frequency, increases the risk of UTIs. Diaphragm use is also associated. Condom use with spermicide or use of birth control pills does not increase the risk of uncomplicated urinary tract infection. Sex. Women are more prone to UTIs than men because in females the urethra is much shorter and closer to the anus. As a woman's estrogen levels decrease with menopause, her risk of urinary tract infections increase due to the loss of protective vaginal flora. Additionally, vaginal atrophy that can sometimes occur after menopause is associated with recurrent urinary tract infections. Chronic prostatitis in the form of chronic prostatitis, chronic pelvic pain syndrome, and chronic bacterial prostatitis may cause recurrent urinary tract infection in males. Risk of infections increases as males age. While bacteria are commonly present in the urine of older males, this does not appear to affect the risk of urinary tract infections. Urinary catheters. Urinary catheterization increases the risk for urinary tract infections. The risk of bacteria in the urine is between 3 and 6% per day, and prophylactic antibiotics are not effective in decreasing symptomatic infections. The risk of an associated infection can be decreased by catheterizing only when necessary, using a septic technique for insertion, and maintaining unobstructed closed drainage of the catheter. Male scuba divers using condom catheters and female divers using external catching devices for their dry suits are also susceptible to urinary tract infections. Others. A predisposition for bladder infections may run in the families. Other risk factors may include diabetes, being uncircumcised, and having a large prostate. In children, UTIs are associated with constipation and abnormal movement of urine from the bladder into the ureters of kidneys. Persons with spinal cord injury are at increased risk for urinary tract infections, in part because of chronic use of catheter and in part because of voiding dysfunction. It is the most common cause of infection in this population, as well as the most common cause of hospitalization. Urinary tract infection diagnosis. In straightforward cases, a diagnosis may be made and treatment given based on the symptoms alone without further laboratory confirmation. In complicated or questionable cases, it may be useful to confirm the diagnosis via urinalysis, looking for the presence of urinary nitrates, white blood cells, leukocytes, or leukocytes esterase. Another test, urine microscopy, looking for the presence of red blood cells, white blood cells, or bacteria. Urine culture is deemed positive if it shows a bacterial colony count of greater than or equal to 10^3 colony-forming units per milliliter of a typical urinary tract organism. Children. To make the diagnosis of a urinary tract infection in children, a positive urinary culture is required. The use of urine bags to collect samples is discouraged by the World Health Organization due to the high rate of contamination when cultured, and catheterization is preferred in those not toilet trained. Some, such as the American Academy of Pediatrics, recommend renal ultrasound and voiding cystorethogram and an imaging technique that allows a medical professional to watch a person's urethra and urinary bladder with real-time x-rays while they urinate. Urinary tract infection treatment. A UTI is treated by a medical and alternative medicine. Alternative treatments. Some research suggests that cranberry juice or capsules may decrease the number of UTIs in those with frequent infections. A Cochrane review concluded that the benefit, if it exists, is small. Long-term tolerance is also an issue, with gastrointestinal upset occurring in more than 30%. Cranberry juice is thus not currently recommended for this indication. As of 2015, probiotics require further study to determine if they are beneficial. The role of the urinary microbiome in maintaining urinary tract health is not well understood as of 2015. Medical treatment. In uncomplicated cases, UTIs are treated with a short course of antibiotics such as nitrofurantoin or trimethoprim sulfamethoxazole. Resistance to many of the antibiotics used to treat this condition is increasing. In complicated cases, a longer course of intravenous antibiotics may be needed. If symptoms do not improve in 2 to 3 days, further diagnostic testing may be needed. Phenazypridine is occasionally prescribed during the first few days in addition to antibiotics to help with the burning and urgency sometimes felt during a bladder infection. However, it is not routinely recommended due to safety concerns with its use, specifically an elevated risk of methylglobulin, higher than normal levels of methylglobulin in the blood. Acetaminophen, paracetamol may be used for fevers. There is no good evidence for the use of cranberry products for treating current infections. Asymptomatic bacteriuria. Those who have bacteria in the urine but no symptoms should not generally be treated with antibiotics. This includes those who are old, those with spinal cord injuries, and those who have urinary catheters. Pregnancy is an exception, and it is recommended that women take 7 days of antibiotics. If not treated, it causes up to 30% of mothers to develop pyelonephritis and increases the risk of low birth weight and preterm birth. Some also support treatment of those with diabetes mellitus and treatment before urinary tract procedures, which will likely cause bleeding. Uncomplicated. Uncomplicated infections can be diagnosed and treated based on symptoms alone. Antibiotics by mouth, such as trimethoprim, sulfamethoxazole, TMP, SMX, nitrofurantoin, or foxfamicin, are typically first line. Cephalosporins, amoxicillin, clavulanic acid, or fluoroquinolin may also be used. However, antibiotic resistance to fluoroquinolins among the bacteria that cause urinary infections has been increasing. The FDA recommends against the use of fluoroquinolins, including a boxed warning, when other options are available due to higher risk of serious side effects such as tendinitis, tendon rupture, and worsening of the myasthenia gravis. For simple UTIs, children often respond to a 3-day course of antibiotics. Women with recurrent simple UTIs are over 90% accurate in identifying new infections. They may benefit from self-treatment upon occurrence of symptoms with medical follow-up only if the initial treatment fails. Complicated. Complicated urinary tract infections are more difficult to treat and usually requires more aggressive evaluation, treatment, and follow-up. It may require identifying and addressing the underlying complication. Increasing antibiotic resistance is causing concern about the future of treating those with complicated and recurrent UTI. Pyelonephritis. Pyelonephritis is treated more aggressively than a simple bladder infection using either a longer course of oral antibiotics or intravenous antibiotics. 7 days of oral fluoroquinoline ciprofloxacin is typically used in areas where there is a resistance and is less than 10%. If local resistance rates are greater than 10%, a dose of intravenous ceftriaxone is often prescribed. In those who exhibit more severe symptoms, admission to a hospital for ongoing antibiotics may be needed. Complications such as a urinary obstruction from a kidney stone may be considered if symptoms do not improve following 2 or 3 days of treatment. Urinary tract infection prevention. A number of measures have been confirmed to affect UTI frequency, including urinating immediately after intercourse, the type of underwear used, personal hygiene methods used after urinating or defecating, or whether a person typically bathes or showers. In those with frequent urinary tract infections who use spermicides or a diaphragm as a method of contraception, they are advised to use alternative methods. In those with benign prostatic hyperplasia, urinating in a sitting position appears to improve bladder emptying with tight decreased urinary tract infections in this group. Using urinary catheters as little and as short of time as possible and appropriate care for the catheter when used prevents catheter-associated urinary tract infections. They should be inserted using sterile technique in hospital. However, non-sterile technique may be inappropriate in those who self-catheterize. The urinary catheter setup should also be kept sealed. Medications. For those with recurrent infections, taking a short course of antibiotics when each infection occurs is associated with the lowest antibiotic use. A prolonged course of daily antibiotics is also effective. Medications frequently used include nitrofurantoin and trimethoprim sulfamethoxazole, methamphetamine, and another agent used to treat infection of the bladder. In cases where infections are related to intercourse, taking antibiotics afterwards may be useful. In postmenopausal women, topical vaginal estrogen has been found to reduce recurrence. Antibiotics following short-term urinary catheterization decreases the subsequent risk of bladder infection. A number of vaccines are in development as of 2018. Children. The evidence that preventative antibiotics decrease urinary tract infection in children is poor. However, recurrent UTIs are a rare cause of further kidney problems if there are no underlying abnormalities of the kidney resulting in less than 1/3 of a percent, 0.33%, of chronic kidney disease in adults. Whether routine circumcision prevents UTIs has not been well studied as of 2011. Thank you for watching the video to the end. Please leave us and subscribe to the channel to help us expand our presence on YouTube. If the video has been helpful, kindly press the bell icon to get notifications of the new uploads.